That's right. We're reading about them, talking about them this Tuesday morning, Odenigbo 99.1 FM. We said we're going to be talking about health, definitely. And our topic of discussion for today, towards a glaucoma-free world. Towards a glaucoma-free world. Now, it's often said that the eyes are the lamp unto the body, meaning that the organs that through which we perceive light, color, movement, and much of the world around us. In fact, experts estimate that about 80% of the information the human brain processes comes through vision. When the eyes function well, they illuminate our surroundings and guide almost every activity of daily life. But when the eyes become diseased or damaged, that light can gradually dim. Vision begins to fade, sometimes slowly, sometimes suddenly. One of the many ways the eyes can lose their light is through a condition known as glaucoma. Glaucoma is not just one disease, but a group of eye conditions that damage the optic nerve, the delicate structure that carries visual information from the eye to the brain. When that nerve becomes damaged, vision can gradually deteriorate and if untreated may lead to permanent blindness. Because it often progresses silently without noticeable symptoms in early stages, glaucoma has long been described by doctors as the silent thief of sight. This week, the global health community marks World Glaucoma Week, an international awareness campaign led by the World Glaucoma Association to draw attention to the growing burden of glaucoma and to encourage people everywhere to check their eyes regularly. The theme for this year is Uniting for a Glaucoma-Free World. But can we truly achieve a glaucoma-free world? How can we do that? Globally, glaucoma already affects about 80 million people, and researchers project that the number could rise to more than 112 million by the year 2040 as population age. The scale of the challenge becomes even clearer when we consider that glaucoma ranks as the second leading cause of blindness globally. And unlike cataracts, the vision lost from glaucoma cannot be restored once the optic nerve is damaged. Here in Nigeria, the situation is also worrying. Studies show that glaucoma accounts for about 17% of blindness in the country, making it the second leading cause of blindness after cataracts. Public health researchers also note that Africans face a higher risk of certain types of glaucoma, particularly primary open-angle glaucoma, which tends to occur earlier and progress more aggressively in people of African descent. But the message of this year's World Glaucoma Week goes beyond medical statistics. It's a call for unity, awareness, early testing and stronger health systems capable of detecting the disease before sight is lost. So, as the world reflects on the growing impact of glaucoma, an important question arises: how can we come together to defeat the silent thief of sight? How close are we to a future where blindness from glaucoma becomes rare rather than common? And in countries like Nigeria, what more needs to be done to protect sight and move closer to the goal of a glaucoma-free world? That's our focus today in our discussion segment. My name is Njideka. Favor Gilbert, co-anchor, is here. Now, joining us to shed more light on this journey to a glaucoma-free world are two optometrists, Dr. Michael Ohaegbu from Nigeria Optometric Association and Dr. Chibugo Ibeabuchi from Guinness Eye Center. Good morning, our two doctors in the house. Thank you so much for joining us.
Good morning. Thank you for having us.
All right. Is it late to say Happy New Year? Since we're seeing you for the first time, so it's good to have you. This week we are marking World Glaucoma Week, right? And we're being told that it will run from March 8 to 14, and then March 12 is the World Glaucoma Day, precisely. Okay, so let me start with you, Dr. Ohaegbu. Now, how do we understand this glaucoma thing? Because every year we get to talk about it, create awareness. And like I was telling you off air, do we really have enough awareness? Because it seems like every year we keep repeating the same thing. Are people really aware of the condition? So, what's this about? How does the layman out there understand glaucoma?
Thank you for having me once more. Right, talking about the awareness on how the layman out there will understand glaucoma. Personally, I have a personal definition for glaucoma. First of all, I call glaucoma a devil.
Okay.
In the sense that, medically we call glaucoma the silent thief of sight. Glaucoma will steal your sight silently without you knowing. Glaucoma on its own doesn't really, there's not much it does to the human eye. What glaucoma affects in the eye is the optic nerve, which is an extension that connects the eye and the brain. Now, think of that optic nerve like a wire, that connects the eye and the brain. If the wire that conducts light to a particular building is burning up, there will still be light in that building until that wire gets totally severed. The light will go off. So when the optic nerve is being damaged, the patient will be seen.
Okay.
Yeah, glaucoma is mostly asymptomatic. You won't know you have glaucoma. Meanwhile, serious damage is going on at the back of the eye, in the optic nerve. So this patient will be seen moving about their normal business without knowing that they are at the risk of imminent blindness. So that's why every week, every second week of March every year, the WHO brings it out to commemorate World Glaucoma Week. Like I was telling your studio, most other diseases have World Diabetes Day, World Hepatitis Day, but glaucoma gets a full week to itself because of the gravity of its danger. Glaucoma is unforgiving. It makes you go blind, before you realize what is happening. Before blood vision starts setting in, it's already at its end stage. And at that point, later on, nothing can be done to survey the situation. So that's why every week we organize programs. Every year we organize programs like this to keep sensitizing people as much as we can, to ensure that people get to know about glaucoma, its dangers, its causes, and who is at risk and who is not. Thank you.
Maybe we should start with the causes now, because you gave some sort of elaboration. It's like a wire connected to the building. But in the case of a wire that is burning up, we can see it. But this one in our eye, we can see when it's gradually being damaged. But what could be the cause? What are the causes, as it were, that would lead to the optic nerve damaging gradually without anybody noticing it?
All right, so that's where the pathophysiology of glaucoma comes in. There's a fluid in the eye called the aqueous fluid. So there's a part of the eye that's responsible for the production of that aqueous fluid. After some time, it drains away. So the pathophysiology of glaucoma has to do with the production and the drainage of that aqueous fluid. So when the drainage channel is not draining properly, or when the production channel is producing more than it should, so there will be accumulation of aqueous fluid in the eye. So once accumulation of aqueous fluid sets in, damage to optic nerve automatically sets in, and glaucoma has started.
Right.
So primarily, you can think of it as accumulation of aqueous fluid due to maybe improper drainage or excessive production of aqueous fluid. So once the aqueous fluid starts accumulating, damage to optic nerve sets in instantly, and glaucoma has started.
So this aqueous fluid, what actually prompts it to accumulate? There must be something that is behind the accumulation, because ordinarily, from what you explained, it's supposed to be drained, if I get you correctly. And so what causes it not to be drained? Is there a human activity that leads to it?
All right. We should have started with the fact that there are actually two types of glaucoma, what we call primary and open angle glaucoma and closed angle glaucoma. Closed angle glaucoma is secondary. It's actually most times as a result of maybe trauma, disease, eye infection, and that one can be treated. But primary angle glaucoma, which is the one that most people actually suffer from, which is untreatable, you only manage it. In that case, the accumulation of aqueous fluid, those persons, that's their body configuration.
Okay.
That's their body configuration. That they have, the drainage channel is not functioning properly, or the production part of the where the equation is produced is not is excessive production. So that's their body configuration. So it is not as if natural body configuration.
Okay.
Yes, mostly primary open angle glaucoma.
So sometimes, sometimes it can be genetic, right?
It's actually genetic. 70% of cases of people with glaucoma, their family history. So it goes from father to children, grandparents to father, So most people that have glaucoma is actually because of the fact that it's generational. So you can the other ones are just secondary. Most of the time, when you see a father, or rather when you get a patient now and you diagnose glaucoma, the next thing the doctor says is, please, can you tell your children to come to the clinic and check their eyes?
Okay.
Because most of the time it's generational.
Okay. If beyond generational, are there some other things that might actually result to it beyond its being genetic? Are there some other activities one is doing that can actually lead to it?
Yes. Another one is trauma. When you have a hit to lung trauma, any type of trauma now to the eye, it can increase it can block the drainage system now. When it blocks it, there is pressure. The pressure in the eye is increased. And with increased pressure, there is damage to optic nerve. That's the first one. Another one is drugs. We call them steroids. There's some drugs you use and they are damaging the eyes, you don't know. So there are other things, there are so many things. And that one is, let's say, I'm actually very sympathetic towards that. We call them congenital glaucoma. That one, a newborn baby is already, you give birth to the child and the child comes up with that. So that's terrible.
Does that one fall under genetic or another type of?
No, it's another type.
Type.
Yes.
Okay. Where does this one fall? Because I'm learning that even people with normal eye pressure can develop glaucoma. Now, you've explained that secondary-wise, it could be prompted by trauma of some sort, an injury to the eye, and then you have the hereditary one, the genetic one. But where does this one fall? When you have normal eye pressure, it can still develop glaucoma. Help us to explain it,
Okay, we call them normal tension glaucoma. That's why we're actually doing this awareness program now, to make people know that actually regular check saves you from blindness, because glaucoma is irreversible. Any damage to the eye can never be salvaged. So we encourage you to do eye checks, especially when you're up to 40 years, because most cases in glaucoma starts from 40 years. Although most cases, like I say, although you see similar cases in younger generation, but most patients with glaucoma, they are up to 40 years. Emphasis on most, not all. So we encourage eye checks. Take your children to, I know here in Nigeria we don't do that, but that's why we are doing this awareness now. So actually, it should be part of what you're doing. School children, invite hospitals, invite doctors come to school to do these screening programs to check. There's another one that another causative factor is actually called refractive errors. The one we learn in school, the long-sightedness and the short-sightedness. People that are short-sighted, that are myopia, they're actually prone to have glaucoma. So these are all the things you check.
People that see only from short distance,
Exactly. So those people, they tend to have they tend to have glaucoma. So these are all the things why this is the reason why we do this awareness, so that we create awareness for people to actually go into the hospitals now. I think this week, most eye clinics you walk into, you tell them you want to do free, you want to screen your eyes for glaucoma. It's actually free. So this is an opportunity for you to actually walk in. Just make sure that your eyes are fine. That you check your pressures to make sure that pressure of the eye is supposed to be between 10 and 21, average of 16. So they check your pressures to make sure that it's okay.
When you say most hospitals, is it any hospital, or are there particular hospitals that you can actually walk in and you have that free access?
All right. Most public-owned hospitals, that's what our general hospitals, even the Federal Teaching Hospital, Guinness Eye Center, having free glaucoma screening. Then there are most private clinics also. You walk into any private clinic and tell them that you want to get yourself screened for glaucoma. Within this week, most clinics have opened their door for free glaucoma screening throughout this World Glaucoma week. So it's actually free in most clinics. Both government owned and private owned.
I'm wondering the level of awareness when it comes to the screening, because it's quite curious. The way you're explaining it is like, okay, anybody can walk into a government hospital that has eye clinic and request to be tested, and it will be done. But I don't know, do you guys get enough cooperation when it comes to that? Do people really walk in and test for glaucoma? How much awareness do we have in Nigeria when it comes to that? And second of all, you talked about private clinic. When people look at private clinics, private hospitals, they're like, okay, these people are just for profit. But hearing you talk about how free it is, it's quite surprising. What's making it possible? So that's like two questions. The level of awareness, and is it really free in private hospital, and what makes it possible?
No, personally, I'm a private practicing practitioner.
Okay.
And one of the most painful experiences you get to see is when you see a patient with end-stage glaucoma. Because at this point, there's nothing you can do for this patient. And you get to tell the patient, Sama, only if you had been here 6 months earlier. Okay. Because you are sure that by 6 months earlier, most likely this person was still seeing. So those of us in the private sector, our doors are open. Walk into any private clinic that you want to get screened for glaucoma. We do this every year. Okay. Every World Glaucoma week we do this. So the doors are open. Come walk into any private clinic that you want to get screened for glaucoma. It will be done.
Dr. Ohaegbu, let me be sure. Like, if a Nigerian walks in to a private eye clinic, they will do it for free. Check you for free.
Yes.
For this period of time.
This period of time.
Just for this period.
For this World Glaucoma week.
Because we need to really
for this World Glaucoma week period of time. Yes.
That's an enlightenment there, because some people will think that after this is a continuum. Well, it's good that you explained it. And so let's look at after you notice that somebody has some sort of problem with the testing or the result of the testing. What happens next? How do you manage it for such a patient?
All right. It depends on the level of vision that the patient can use. In glaucoma management, the only thing you as the doctor is battling is to return whatever vision the patient came in today, facilitate with. Glaucoma causes irreversible blindness. So whatever vision that has been lost prior to the patient reporting has been lost permanently. So whatever management you are doing as a doctor is to return whatever vision the patient came in with. And there are a lot of ways we give drugs. There are also surgical means that glaucoma can be managed, drugs, and then the patient will be visiting the facility regularly for series of tests, intraocular pressure test, which is very, very necessary that the pressure of the eyes will be maintained within a particular normal range. So once it starts going high again, there is problem.
That little site remaining, will it be retained with the management, with the drugs and everything? Will it be retained in a way that it will not be lost totally?
Oh yes, it can be retained.
Okay, like you said, early detection is the key. That's why we are creating awareness. Early detection is the key. When you come in with end-stage glaucoma, you don't expect miracles actually. But when you walk into the clinic and you have at least 30% of your vision, you can live. If it's properly managed, you adhere to your doctor, visit the clinic, visit your hospital when they say you should go to hospital, your appointment, you follow up with your appointment. Use your drugs properly because it's properly managed with drugs. So when you use your drugs properly, you should have you can see for decades actually. Yes, I've seen people that have lived with glaucoma for 20, 30, 40 years and they are still seeing.
Okay.
So it's more or less like, okay, I reported and okay, the doctor said I have glaucoma, fine. You don't go, most people will tell you, okay, they start going to prayer houses and the rest of them. Yes, I believe in God. I believe God, with God, all things are possible. But at least when you're praying, you're also using your medications. So it's not just about, okay, praying and you leave your drugs. When you pray, you use your drugs so that that remaining eyesight that you have, you won't lose it.
You initially mentioned that one can get this glaucoma through some of the kind of drugs the person takes. So I'm wondering how we should start. What kind of drugs contains these? You call these steroids. What kind of drugs contain all of these things, and how should one manage? Because one cannot just start taking drugs without a prescription. Sometimes you are taking it just for a particular ailment, not knowing that you are creating another ailment for yourself. So how should we manage it?
Actually, self-medication is like the main thing here in this part of the world now. Like, if I'm allowed to say that. Any little thing, if we have red eye, we go to pharmacy and we get something. Any little thing we go to. Sometimes we get the drugs you are getting, they actually damaging to you. You don't know. I'm not saying just when you use it for like a week or two, you start damaging. Over time, there are some people that, okay, I use this particular drug, these pain drugs. Even you're not even supposed to be addicted to a pain relief. Okay? So you got this drug and the doctor recommended it. After a while, you'll be like, okay, I remember the last time I went to hospital and I was given this. Person goes to pharmacy with the same pattern and everything. I give it to the pharmacist and the person just gives you back. Over time, it's not a week, it's not 2, it's not 1 month, it might be 3 months. The person is now addicted to using this kind of drug. Over time, it will now cause blockage.
Dr. Ibeabuchi, continuing with your thought, are you saying it's only when we self-medicate that this can lead to some sort of pressure on the eye and then subsequently glaucoma? Is it possible that even recommended drugs from experts can lead to this? What do you have to say?
Okay, when an expert or professional gives you such drug, they know the side effects, adverse effects, as the case may be. So they monitor you. They do what we call tapering. There's a way you reduce the drug. That's why you don't use it for a long time. Even those that use it there's a period of time. Okay, surgery. After surgery, you are giving it. There's some eye surgeries you do, and you'll be giving such drug. But with that, there are follow-up visits. When you come back, the doctor looks at your eyes and be like, okay, it's time to reduce the dosage now. If you are given maybe 4 times daily, they might reduce it to 3 times daily. They tell you to go back and come back a certain day. So you see, with these experts, they are monitoring the drugs. They are monitoring it together with your eye pressures too, to make sure they are working hand in hand. Or you going home now, you stop visiting your hospital and you are now doing it on your own. So is the monitoring now. Monitoring aspect of it. The professionals are there monitoring with their equipment, with the tonometry and the rest of them to make sure that these pressures are quite controlled.
Is it all the time that doctors actually let you to know the side effects of drugs? Because sometimes even when you want to look or ask questions about the name of the drugs they are giving you when you go to hospitals and you see the pharmacists that will not want to tell you the name. Okay, so what you're saying is like you're anticipating the doctor to tell the patient the side effects, but is it in all cases we see this, or does the responsibility now lie on the patient to ask if there is a possible side effect of this drug I'm taking, and how often do Nigerians do this, Dr. Ohaegbu?
Talking about this drug-related issue, mostly steroids. As a practitioner, when you are prescribing drugs to patients, you already know the likely adverse effects of the patient, so you know how to tamper with the dosages and the rest of it. The major problem is self-medication.
Really?
That's why some drugs are not supposed to be accessed over the counter.
Okay.
There are some drugs you must have prescription for before you can access them. So the major problem is self-medication. You just walk into any patent medicine dealer and purchase drugs. Let me tell you an experience I had some time ago. I had this patient, a young guy in his early 20s. Okay. He has cataract of full-blown matured cataract. He is very, very slim. He went to quote unquote the people who call chemist that he wants to add with, and the chemist gave him a cup of very strong steroids. I don't want to mention the name on air. And he was bombarding himself with that medication, and one eye blew up with cataract. So the major problem is self-medication. The drugs we purchase over the counter.
Okay, when you say steroid, please can you explain it to people? Steroid, what does it do?
There are some certain medications called steroids. And steroids they come in both eye drop, tablets, injection, and the rest of them. Steroids are medications that even you as a practitioner you dispense with, you prescribe with carefulness and caution. Even consultants dispense and prescribe and dispense steroids with carefulness and serious caution. So these medications are not medications that ordinarily you should get over the counter. When you walk into most pharmacies, they will require a doctor's prescription before they can give out such medications to you. But we are in a country
what is the work? What is the work? Specific work of steroids?
Steroids are anti-inflammatory medications. They're anti-inflammatory medications, but they are very, very potent anti-inflammatory. On the other side, very serious adverse effects. So that's why you as a practitioner know these adverse effects. So when you are prescribing them, you are very, very cautious and very careful on how you. Most times when you prescribe, you do what you call tampering in the dosage.
When you talk about the fact that people are self-medicating and maybe they get a particular drugs from the doctor, and when such ailment shows itself again, they go get the same drug because they felt, it actually helped me the previous time I had that particular issue. And with the fact that some of these drugs might contain steroids, and that person is not aware of it. So with the fact that doctors prescribe drugs to patients, and with the fact that some of these drugs contain steroids, and doctors won't tell you that something like this is in these drugs and look at the adverse effect. And with the fact that Nigerians are prone to self-medicating, why? Maybe because most times if they go to visit the doctors, it might be very expensive for them, and they feel that this drug has actually done wonders for me initially. Is with all of these things in place, are the medical practitioners actually doing enough to sensitize the public on the reasons why they should not self-medicate? And also, once they give them these drugs, are they telling them the adverse effect? Should they tell them the adverse effect of these drugs, which is why you shouldn't take it without my consent?
All right. Ordinarily, in the healthcare industry, a doctor prescribes the drugs. The pharmacist dispenses it. So it's at that pharmacy unit that the patient should know, the adverse effects and what to expect, from these drugs. But we are talking about glaucoma. Even in glaucoma, we have so many, classes of anti-glaucoma drugs. So when you give a patient a medication and they will take the part to go and buy the medication because it worked wonders for them, you might be using a particular anti-glaucoma medication and the pressure of your eyes will still be going up. So that's where that regular check-up, visiting your doctor. When the doctor checks your pressure again and you're on this medication, what would the doctor do? Change the medication. There are so many classes of anti-glaucoma drugs, and all of them, their pharmacokinetics are not the same. How they work are not the same. So that's where ordinarily you as a patient shouldn't, because the doctor gave you these drugs, next time you take the pack, walk into any open market to go and purchase it. It is wrong. Nigerians should stop doing it. It's wrong.
But it's not just about the anti-glaucoma drugs. It's also about other regular drugs you talked about, like steroid. Because the initial impression you created was, okay, doctors are very diligent when it comes to telling patients the side effects of this. It's just patients that go ahead and self-medicate. So I think perhaps we need to really question whether our medical practitioners really explain most of those things in greater detail. Because from my observation, it's not all doctors that do this. You also give the impression that it's the pharmacist that is supposed to, as against the doctor. I would think that maybe the doctor should start the process. The pharmacy is just to dispense. Maybe that was why when I asked that pharmacist, okay, what's the name of this drug? They didn't answer me. But if I had asked the doctor what I recommended, maybe he could have explained it better. But that's just by the way. You talked about pressure, preventing injury and all that. What are the things that we do that put on, there is a physical pressure and subsequently impact the optic nerve? What can Nigerians do to prevent that? What are those activities so that we can stop doing them? Doctor, okay, let me take you to Dr. Ibeabuchi. Yes.
Okay, the things we do, like I said, glaucoma is complex in its is a condition that is complex. So I would say that is scientifically there is no sport that you do now that will tell you it's build up pressure in the eye.
Okay.
There are some activities that you do quite alright that might increase the pressures of your eyes, but fundamentally it's actually hereditary now. Other things are just secondary. I cannot just come out and say, okay, this is it.
Okay, that was why you said 70% majorly genetic.
Other things are just secondary. In my work with this person might play football today and the pressure increase.
Okay.
The next person might play football and the pressure is okay. So it's not yet scientifically proven that, okay, this sport makes the pressure of the eye to increase.
Is it the sport, or maybe when you're doing it and there's a heat in your eye?
Thank you. Like I said, that when you have trauma now in the eye, anything that disturbs the morphology of the eye can increase the pressure of the eye.
Okay, so let's talk about what I say treatment now. Are there foods that one can eat to help the eye? You know, sometimes they tell us about eating well. And I want to imagine that the eyes can be fed, because the eyes feeds on things. So the eyes need to also feed on something. Is there anything that we need to eat to ensure that the eyes are really stable and can withstand some sort of pressure?
Yes, definitely. Like healthy foods. We all practice you say healthy food, reduce your fatty intake. Then again, we call them yellow fruits. Yellow fruits, fruits like carrots, fruits like oranges, fruits like pawpaw. Fruits in season, they are actually good. Whatever fits the body fits the eye. So you help the eye to flush properly, to keep it healthy at all times. But we call them yellow fruits. Yellow fruits are good for the eyes, actually. Carrots, the pawpaw, the oranges, the apples are good.
Well, some persons, have this ideology of the onion. Like if you want to clean your eye, you eat the onions. What do you make of that?
Onion is good.
Okay.
But I've also heard that eating it is fine.
Okay.
Why I've seen people that use the liquid inside their eye.
Okay.
Those ones are not good. But eating it is fine. Like I said, what fits the body fits the eye. Because when the body is healthy, the eye is also healthy too.
Indeed. Okay, if you have just joined us, we have been speaking with Dr. Michael Ohaegbu from Nigeria Optometric Association and Dr. Chibugo Ibeabuchi from Guinness Eye Center. They have been speaking about the Glaucoma Week, which is running from March 8 to 14. Just like Dr. Ohaegbu said, that the eye is so important, and the conditions that come to them is so severe, and that's why a whole week is dedicated to it. And this week is not for fun; it's to create awareness. March 12th is the World Glaucoma Day. As we say, Gong Gong. Okay, so let's talk about the places they can visit, because here I've talked about this week going to be some sort of free testing and possible treatment. Are there places you can talk about on top of your head, or list on top of your head, that Nigerians can begin, the ones that are listening, can go there right about now and begin to test their eye? Dr. Ohaegbu.
All right. There are places here in Anambra State, the Nigeria Optometric Association is commemorating the World Glaucoma Week, and there are a handful of facilities. The Ministry of Health Secretariat Eye Clinic, there at the State Secretariat in Oka. Walk in there, you get free screening. The General Hospital at Inori, Solution Specialist Hospital Fige, General Hospital Nobe, General Hospital Rumba, General Hospital Kulobia, General Hospital Orifite, and Guinness Eye Center in Onitsha. Then there are also, like I mentioned, most private eye clinics. Walk in, you want to get a glaucoma screening, you get it free.
The name is just
the name is not yes, yeah.
Okay, let's look at these risk factors. I mean, the people at the high risk group, because you talked about persons at 40 years. You've talked about people with genetic history. Who are other people who are at risk, and why are they at this high risk, and what they can do to stop being at high risk, if at all they can do anything?
All right, we've talked about genetic factor. The next set of people who also at risk. We've also talked about the trauma. People who have trauma.
Yes.
We've also talked about age. The next set of people who are also at risk are Africans, Black Africans, are at more risk of glaucoma than Caucasians.
Why?
Because
There's got to be an explanation.
Exactly.
Part of it,
Okay.
just the way there are some
Is there
elements.
something in the body? Because sometimes they'll tell you melanin is responsible for our black color. So what could be responsible for us being disposed to or disposable to glaucoma? Is there something in the gene or something?
Let me put it, the pathophysiology of glaucoma, the production of aqueous fluid and its drainage, most times in Black Africans, in comparison with Caucasians, it doesn't tally. So that puts us at more risk. Remember, I told you it has to do with production of aqueous fluid and its drainage.
Okay.
So in Africans, you have more Africans with, more closed drainage channel than Caucasians. So the next set of people are people with high blood pressure are also at risk of glaucoma, chronic, even diabetics. They are also at risk of glaucoma. So
again, females too.
Well, okay. I think you should actually list all of these things, for people to get.
When you're now talking about percentage now, you have more females having glaucoma than males.
Okay.
That's just for the fact that we are a female in Nigeria. We have more than.
So our drainage channel is now closed more.
The female body undergoes a whole lot of things.
Yes.
So you can't compare it with the male body. So those things predisposes the
childbirth.
So women develop some ailments after childbirth.
So it's not just trauma of the eye; it's also trauma of the body.
Yes. I think that's the way to put it. Okay, we're almost winding down. What are the commonest stories you get to hear from patients that perhaps you may need to share with us? You have talked about how maybe some people will come at the dying minute, but are there other things that patients tell you, that you want to share, just to enlighten people who are listening at the moment?
Okay, there are different causes of blindness, but personally, as Dr. Ohaegbu, I have my own 4 leading causes of blindness. 1 is ignorance.
Okay.
2 is poverty. 3 is stupidity. And 4 is stubbornness.
Okay. Wow.
That's my own personal formulation. So I might excuse someone due to poverty and ignorance, but stupidity and stubbornness. But living glaucoma now, you get to see a patient. People are still doing some awkward practices in this time and age. People are still applying urine to their eyes. Still applying sugar solution to their eyes. People are still applying breast milk.
Cooking their urine.
Cooking their eyes.
Cooking.
How?
People are still applying breast milk to the eyes of a baby in this time and age. And these are very dangerous practices. And these are things you see on a daily. So we tell people, stop. Whenever you have an eye issue, the eye is a very delicate part of the body. You can be seeing today and tomorrow very little thing before if not handled properly, that eye is gone. So whenever you have an eye issue, visit an eye health facility. Don't self-medicate. Don't go to a patent medicine dealer to buy one random eye drop and start applying to your eye. Visit an eye health facility for proper examination and management.
So where do they get to hear all of these, let's say, self-medicating practices? Who tells them these things, just so that we can create awareness on that? Where do people hear that you can apply urine, you can apply milk, that kind of, where do they get it from?
Okay, I'm now talking about the stories we heard from our mom, our grandparents, and the rest of them, that they will tell you breast milk cures everything. Especially when you are much younger. They'll tell you breast milk contains a lot of nutrients and everything, and because it has a lot of nutrients, it can clear up anything. That's a wrong notion, because eye has its level of as pH level. You have this pH level your eye should maintain at all times. So when you interrupt that pH level, you're causing something else. It's like you are inducing inflammation, you're causing infection, or you're blocking the drainage system. There are so many things that can happen with that. So before you do that, like you said, ignorance. I understand the fact that you are not you don't understand what you're doing. So there are people that actually know. I've seen cases of people that actually come to report to the clinic, and they tell them, okay, you have glaucoma, give you this drug. They will use it the first month, use the second month, and they stop. They'll tell you, okay, it's God, all things are possible. God helps. It helps those who help themselves. Okay.
Yes.
So when you are also you're praying, you are fasting, you are doing everything at the same time. Do what you're supposed to do.
Okay.
I wonder how we can start, doing away with all of these myths, because all of these things are myths. I remember someone told me some time ago that this thing you call Apollo, that if you want to deal with it, your early morning urine, once you use your early morning urine on it, it clears it.
I think it starts with family now. Family is the smallest unit of information for me. So when you give birth to your own child, you educate your child properly. As in the education we get at home, now, because you start with your child, with your little baby, before he or she goes to school, and they will now start telling you, okay, do this, do that. The education you get from home will now lead you to schools. Schools will now educate more. I don't want to believe that there are some schools that will tell you, okay, do this and don't do this. There is no school that will teach your child wrongly.
But you can't give what you don't have. I mean, it takes an educated and enlightened set of parents to be able to not do this kind of thing. And so at the end of the day, the question will be, how educated and enlightened are our parents? Before they now go to school and be taught rightly. And so if a parent is listening to us now, whatever it is you had learnt before, we're telling you that is not the right knowledge. Please stop. I think the doctors in the house are precisely telling us that the eyes are fragile and very sensitive. Anything you apply there could do damage to the eye. Do you have any parting shot? Let's just wrap it up before we go. Dr. Ibeabuchi, then Dr. Ohaegbu.
Okay, for me, I would say visit your regular checkup. And we can do this awareness, and yet there are some times when you do it, people might not even walk in. But I would advise you to just walk in. Then when you are diagnosed of that, it's not the end of the world.
Okay.
There are management, there are drugs to use. When you use them, you can see, like I said, for decades. I've seen someone that lived with glaucoma for 30 years.
Okay.
I'm using my own dad as an example.
Okay.
My dad is glaucomatous. But so that means that I'm also predisposed to that, because I told you it has to his family history now.
Okay.
So that does it mean that I will not now
So you're managing yourself, and were you able to intervene? Were you the one that intervened in the case of
Actually, I was the one that saw it for the first time.
Wow.
And it was very early. I think that was 2021.
Wow.
Or 2020. I can't remember, but so God be the glory. It's still at that same point where I met it.
Wow. I'm sure he's proud of you. I sent my daughter to school, and this is the benefit. I mean, that's why they said send girls to school. We just celebrated International Women's Day. I mean, this is one of the benefits of talking about empowering women, not just through education, but vocational skills as well. And so, Dr. Ohaegbu, please, your parting short.
It goes beyond blindness. Glaucoma causes irreversible blindness.
Okay.
And there is also what we call blindness-related depression. So when someone goes blind, that person will automatically become depressed, most likely for the rest of their life. Glaucoma, the only way you can beat glaucoma is by early detection. If you walk into any facility with end-stage glaucoma, nothing can be done for you. So early detection early detection. We'll keep hammering on early detection. If you're walking when there are still, distant vision in the eye, believe you me, that person will have. It's just like diabetes. There are former President Obasanjo said that he has been diabetic since 1970s.
Right.
Yes. Meanwhile, some other person developed diabetes and they died within five years. So it's management. It's management, right management. So when you're walking when there is still decent vision in the eye, with the proper management, that person will get to see for the rest of their life.
So
early detection.
Early detection, indeed. What an enlightenment. Thank you so much, Dr. Michael Ohaegbu from Nigeria Optometric Association and Dr. Chibugo Ibeabuchi from Guinness Eye Center. We appreciate your time this morning on Odenigbo 99.1 FM, hoping that you have a good outing during this World Glaucoma Week. You said people are not really always coming. Hoping with this talk now, I know they are listening. They'll be able to walk in freely. This week, if you're listening after this week, it might not be free. Please, so visit any of the hospitals that they talked about and help yourself. On that note, we're saying a very big thank you to everyone who joined the conversation, talking health, talking wellness, talking Nigeria. That conversation will continue tomorrow. To then, my name is Njideka. I'll see you again.
And I am Favored Hubert. Thank you for listening.